so there is something called morning sickness. So morning sickness only happens in morning?
Oh no, definitely not.
Okay.
Morning sickness is a term coined because the nausea and vomiting is much higher usually in the morning. That's because they have been on an empty stomach. So the acid and everything has been secreted overnight, and they do have an acid reflux. So you know, khatti dakar bolte hai. So they do have some nausea, vomiting, but it is not restricted to morning, trust me. There may be some patients who are vomiting the whole day. You know, they may be nauseated and vomiting. So again, the quick remedy for this would be to tell the patient to eat small, eat more frequently, so there is not too much of acid generating. And we often prescribe medications to cause some symptomatic relief. So a lot of patients ask me कि doctor, is it safe to take this tablet? मैं ना जितना हो सके avoid करती हूँ tablet लेना. तो कोई ज़रूरत नहीं है, because you will make yourself very miserable, and definitely the medication that we are prescribing in pregnancy is something that's going to be permitted, or it's going to be safe, and you don't have to worry about the baby.
Right. So basically, taking smaller meals
frequently
helps them to have these
and
issues.
Not to eat food that is very high on spice, or not to eat food very high on garam masala. So you know, nice bland diet, simple bland dahi chawal, fruits, buttermilk, curd, milkshakes.
The lighter,
these are the things,
better.
Yes, these are the things patients are very happy to eat usually.
So ma'am, what about the exercise? Do they really should avoid doing exercise, or they should be doing exercise?
No, I don't think they should avoid exercise. I tell my patients something very simple. Eat whatever you were eating. You know, very often when they come with the pregnancy, they want to know, मैं क्या खा सकती हूँ? Continue eating whatever you can eat and whatever you used to eat, and continue doing those activities that you were doing. So if a woman was used to a certain exercise, she should go ahead and do it. Again, I don't recommend starting new exercises or, you know, doing some exertional activities because you're pregnant. You just should do what your body is used to. But definitely there's a role of exercise, definitely there's a role for a walk, and definitely there is a role for antenatal exercises. Now we have a very evolved physiotherapy department, and we work in tandem. So our physiotherapist, you know, teaches our patient some group of exercises which they can do, and these patients can then practice those exercises at home. So that's how we follow, you know, a diet counseling from a dietitian, a physiotherapist guiding about exercises, us recommending a simple walk, and you know, try to give a package deal to our patients.
Great. So ma'am, does a woman who is pregnant should not have an intercourse during her pregnancy time?
Again, that's a question that a lot of patients ask. Now, in the start of pregnancy, they are also, you know, just coming to terms with it, and there is a fear in our mind of a miscarriage. In the first 2 to 3 months of pregnancy, everyone is worried that what if there is a bleeding or spotting or miscarriage. Hence, I ask my patients to avoid intercourse for the first 2 to 3 months. Also, I ask them to avoid intercourse in the last part of pregnancy. Of course, with such a big belly and, you know, the fear of going in labor, they are not going to be comfortable having intercourse. But typically the second trimester, that is from the 4th month to the 6th or 7th month, if the woman is comfortable and if she is keen on it, there is nothing stopping, they can have intercourse. Of course, this should be discussed with your doctor. So the doctor who is treating you for pregnancy should have examined you and told you that everything is good, and then you can continue your sexual life.
Great. So ma'am, talking about the same pregnancy, so is caffeine allowed?
Fine. So let's about the foods, you know, do's and don'ts. So usually I tell my patients to avoid papaya and pineapple. After having said that, definitely a no for smoking, no for drinks. Those are absolutely off the list. As far as caffeine goes, well, these are all stimulants, you know, whether it's caffeine or tea. So we ask them to take in moderation. We do not want them to have 6 cups of coffee. But yeah, if she's used to 1 cup of coffee and her family members are now restricting her, one need not go to that extreme lengths. If they like a cup of coffee, they can, you know, have it, but not shots of coffee.